It is standard practice to give dual antiplatelet therapy after implantation of a drug-eluting stent in a coronary artery. The question of continuing has been addressed in the DAPT study. The results of the DAPT study for the diabetic subset was published in Circulation. Around 12,000 patients who received dual antiplatelet therapy for 1 year after coronary stenting and free of ischemic or bleeding complications were randomized to further 18 months of dual antiplatelet or single antiplatelet therapy. It was found that there is a further reduction in stent thrombosis and myocardial infarction by extended dual antiplatelet therapy, but the benefits were attenuated in diabetic patients. Still, the benefits were better than single antiplatelet agent even in the diabetic subset. So we have evidence for extended dual antiplatelet therapy beyond 1 year after coronary stenting in those without any bleeding complications. The important reason for stepping down to single antiplatelet therapy after 1 year is mainly that the bleeding risk became comparable to the benefit of prolonged dual antiplatelet therapy. Moreover, many patients who suffer fractures or have other indications for semi-urgent non-cardiac surgery had to wait for surgery during discontinuation of the second antiplatelet agent. If patient is only on aspirin, most surgeons take up the case if the surgery is not associated with a high bleeding risk. Same is true of anesthesiologists agreeing for neuraxial blocks. With newer generation drug-eluting stents, shorter duration of antiplatelets are likely.